Today I'll be talking about regenerative medicine with a special aspect, how to use regenerative medicine in your own clinic safely, effectively, legally, so that you can use it for the benefit of patients. At present, when we are doing regenerative medicine, or rather when many doctors want to enter into this field, the only thing they have available is hearsay evidence. That is, someone has told in some place that exosomes may be helpful. Someone has spoken at some place that PRP is beneficial or not beneficial. But where is the science? When we became medical graduates, we were taught three important things. Physiology, how does the tissue work? Pathology, what is the actual underlying problem at a cellular level? And pharmacology, how does a particular drug or a molecule or a vitamin help us? What is the step involved? It was never a hit and trial. Aim of today's webinar is to be able to give a framework using which doctors, young doctors especially, so like I said, the next decade of medicine will belong to biology. Unless we understand and apply biology specifically for each patient, we are not going to become great doctors. Medicine is shifting from disease treatment or symptom suppression or isolated procedures towards tissue regeneration, biological optimization, joint support. Most of doctors, especially doctors performing hair transplants, have problems with cervical spine, lumbosacral spine, SI joint, their hip joints. Why? Because when you perform surgeries for 2 days, 8 hours a day, for the better part of your life, your spine bears the brunt. So we have to understand that regenerative medicine, it is no longer a niche. It is not something that an endocrinologist will be able to do, not something that a ortho will be able to do, or a dermat. It is something for which you require a broad knowledge, a broad capacity to understand, a reversal from hyper specialization. I welcome you to the Live Young movement. Be the doctors leading this. Right now, the biggest problem for doctors entering regenerative medicine is excessive hype. One day they hear about a particular injection. Another day, MR comes saying that they have special type of tubes which will make the PRP better. They, of course, have legal concerns because they are dabbling in many illegal or not yet approved unsafe protocols. When you were young, when you were doing your medical studies, there were teachers. They taught you this is the correct way. Right now, it is not available in medical colleges. There is no systematic education on regenerative medicine. There is a lack of structured education combined with a confusing social media marketing. Doctors entering into the regenerative field do not require massive infrastructure. What you need is education and a standardization of techniques, the legally approved ones. For these, I have introduced a few easy steps. The easiest is, because nowadays people don't want to read books, sometimes not even ebooks. They want to see videos, sometimes not even see videos. They just want to hear. So we have a 28-day program. Just listen for 15 to 20 minutes every day. Listen to the regenerative protocol of that day. Listen to the regenerative knowledge of the day. If you follow it religiously, I assure you, follow it meticulously, and in 28 to 30 days, you will have a baseline working knowledge of regenerative medicine. You will not have to keep on asking others what I should use. So 15 to 20 minutes is the minimum I ask you. A simple guided learning program which will help you understand the science, clinical applications, the safety profiles, and how to practically implement that. Later on, if you are more interested, you can go for the full day Zoom link class. Many doctors come for that. 5 to 6 hours, I teach how, because an orthopedician does not know how to do microneedling. A heart physician does not know how to do micro-infusion. But those are minor techniques. They are not major ones. A full day Zoom link class will be your next step, where you can see in front of your eyes how to do it, how I do the regenerative protocols for my patients. For those wishing to go more in depth, like one of my dear friend, Dr. Patrick Mawamba, he did. All it takes is a single day, but a full day. Learn everything. So step by step, we can proceed from microneedling, understanding how to do it in the correct manner, what all benefits you can get, whether it is on the head, whether it is on your face, on the neck. Our skin is a very large organ, not something that only has pimples or rashes. It is also the largest organ which can absorb small molecules, distribute them in a targeted manner. Microneedling and microinfusion are those two very important techniques, followed by regenerative topicals. We don't have to go for extremely dangerous procedures or drugs which are not yet allowed.